Today's checklist is sponsored by Boehringer Ingelheim. Go to detectthesos.com for more information.
We're back with today's checklist. Now, according to the American Heart Association, heart disease remains the leading cause of death in the United States. So this morning, we want to look at the 5 essential categories to help us protect one of our body's hardest working muscles. Dr. Roshini Raj is an associate professor of medicine at NYU Langone Health. Dr. Raj, good to see you again.
Good to see you all.
Okay, so let's start first with blood pressure. What's your ideal number? And I know it's got to vary for everybody, but what you should be looking at?
Yeah, so if you want to think about one number that you really want to be under, it's under 120/80. So that, and by the way, that's lower than what it used to be historically. So 120 is the systolic blood pressure and 80 is the diastolic. So what does that mean? So blood pressure is literally the pressure of the blood against the walls of your arteries. And why that's important is because your heart has to pump even harder if that pressure is high, because it's against a lot of resistance. That can put strain on your heart, so of course increase the risk of heart attacks as well as stroke, but also that blood pressure can cause damage to the walls of the arteries, and that will increase your risk of developing plaque or atherosclerosis. So really important to make sure you're under 120/80, and talk to your doctor. For some people it should be even lower, and we do know that blood pressure doesn't cause symptoms actually unless it's very high. So it's one of those silent diseases, which is why you need to get that number checked.
Could it be too low?
Yes, you can have too low blood pressure and people can get dizzy and weak, and so that's a totally different issue. But we're talking about what increases your risk of heart attacks, and that would be elevated blood pressure.
Potassium-rich diet, huh?
Yeah, so potassium, Fatima, who did my makeup today, was eating a banana, so bananas are a great source of potassium. I love dried apricots, but it's in a lot of vegetables as well, spinach, for example. That can help lower your blood pressure, and reducing sodium in the diet is important as well.
Okay. Let's talk about cholesterol now. And you say we need to pay closer attention to LDL.
Yes. So when you get that lipid panel, you get a few different numbers. LDL is an important one. That's the bad cholesterol, low-density lipoprotein. And why is LDL so bad? Because it does collect in the arteries. It can cause plaque and clot formation in your arteries as well, increasing your risk of heart attack. And so the number that you want to be below, and again, this is lower than what we used to say, is 70. So 70 is actually not very high. And if you have a history of heart disease, your doctor might want it even lower. But this is something you want to pay attention to. Again, the diet is very important here. But also fiber. Increasing fiber in your diet has been shown to reduce cholesterol as well.
And saturated fat continues to be the enemy?
It does. So you want to really avoid the saturated fats, which we find in meats and full-fat dairy, and replace that with the healthy fats, things that are in avocado and olive oil, things like that.
Let's talk triglycerides here for a moment.
Yes.
What's the magic number there?
So the magic number for triglycerides is 150. This is another number you'll see in that lipid panel that you're getting. So triglycerides, these are circulating fats in your body, and if you have an excess of sugar and alcohol and calories in your diet, that gets converted into triglycerides. So you want to make sure that, again, with your diet, you're reducing saturated fat, because this can also be damaging to the walls of your arteries.
You want foods high in omega-3s?
Yes, so walnuts, salmon, if you have a diet rich in omega-3s, that can really help reduce your triglyceride level.
Okay, how about high blood sugar, which is linked with diabetes?
Yes, of course. So, we have circulating blood sugar, and the fasting blood sugar that you want to have ideally is less than 100. And that's because when your body becomes resistant to insulin, that's the hormone that forces the blood sugar into the cells out of the bloodstream, that can really cause an increased risk of heart disease, because again, that circulating blood sugar can cause damage to your arteries, number one, but it also makes the LDL that we talked about earlier more toxic as well. So definitely with diabetes, you want to watch sugary foods, but also increasing fiber in this case as well has been shown to decrease blood sugar.
Okay, and the last one, waist circumference.
Yeah,
it's different for men and women.
It is different for men and women. So we say ideally 35 or less for women and 40 or less for men. Another way you can calculate it is your height, because height does affect this. So if you think about your height in inches and divided by 2, that's another kind of number you want to stay under. So everyone's doing the mental math.
Doing math right now.
Yeah.
Is the math?
Yeah. And why is this important? First of all, where should we measure? It's right above your belly button. And it's important because the belly fat actually actually implies that there is fat, what we call visceral fat, surrounding your abdominal organs. And this is dangerous because that kind of visceral fat will secrete hormones that can increase inflammation, which also increases heart attack risk. Many people think of heart disease actually now as an inflammatory condition. So you want to reduce the belly fat. And it's not about doing crunches. It really is about reducing fat in your diet, reducing caloric intake overall, and increasing exercise.
By the way, what I'm hearing from a lot of this is you need to go to the doctor, too, to find out your numbers.
100%, you do.
And healthy.
That's right, to have a baseline. Great. All right, Dr. Raj, thanks so much.
Nice to see you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.